Hi, my name is Victoria Black. I'm an independent midwife. Today I'm going to talk to you about caring for your baby's umbilical cord after the birth. So often when clients ask me about what to use to care for the baby's umbilical cord, they often mention surgical spirits. Back in 2017, South Africa developed new newborn skincare guidelines and have since then not recommended the use of surgical spirits for caring for the umbilical cord. It often causes chemical burns on the skin, and it takes long for the umbilical cord to dry. Although it is something that is very freely available and it's not very expensive, it's not recommended for the umbilical cord. There are, however, other things we use that are way more effective that helps the umbilical cord to stay clean and dry quite quickly and effectively. The first thing that we would use is just plain water and cotton wool. Sometimes that's all that moms have available to them, and it just helps to wipe away the little bit of goo and gunk that collects on the umbilical cord as it naturally dries. To help speed up the process, we can use things like salt water. So you get medical salt water, normal saline, which you can buy at a pharmacy, or you could even make it yourself at home. At home, you can boil water, half a liter, let it cool down, and you add 1 tablespoon of sea salt. You mix it up really well, and you've made yourself your own normal saline at home. You can keep using that liquid to clean the umbilical cord with some clean cotton wool that you have in your baby bag or that you've packed to go with to the hospital where you give birth. With the cotton wool and the salt water, you will dip it in the salt water solution, squeeze out the excess fluid, and wipe from the umbilical cord, from the belly button away to the umbilical cord clamp, and you'll repeat that all around the umbilical cord. Please do not be afraid to touch your baby's umbilical cord. There are no nerves in the umbilical cord itself. You are not hurting your baby even if they do start crying. They often just cry because you are touching them with something cold and they don't like the sensation of that on their skin. Once you've cleaned it, you can discard the cotton wool and you can take a clean one until you are sure everything is wiped away. The cord will dry quite well naturally by itself. Another product that you can use is a homeopathic antibacterial powder called Wexin powder. In the past it was called weeping wound powder. This powder is very easy to apply to the umbilical cord and can be used in conjunction with the salt water. With the drying of the umbilical cord, you can first wipe away the excess gunk and liquid like the goo that accumulates around the umbilical cord as it dries, and then let that air dry for a little bit, and then apply the Wexin powder like you are seasoning meat. You just sprinkle it all over the umbilical cord, specifically focusing at the base of the umbilical cord, which is closest to the belly button. I often find with this method the cord will fall off within just a few days, where previously with clients that were using surgical spirits, it could take even between 10 to 14 days after the birth for the umbilical cord to fall off and to dry sufficiently. After the umbilical cord has fallen off, it may take a few more weeks for that skin to heal completely and the belly button to fold in on itself. Continue to clean it with the salt water and allow it to air dry. Some practical tips: try when you are changing your baby's nappy to first apply the nappy, put the straps on quite firmly, and then pull the umbilical cord outside of the nappy so that it can air dry. And if you notice that there is a lot of goo that has collected around the umbilical cord, that you just wipe that away every time you change the nappy. When to be concerned about the baby's umbilical cord is if it starts to have a very funny smell or the skin around the belly button goes very red. That may be a sign that your baby has now developed an infection and needs urgent medical care. please take the baby immediately to your nearest clinic or hospital or private healthcare provider that you have been seeing during the pregnancy so that it can be urgently attended to. With the belly button, the biggest question I get asked after the umbilical cord has fallen off: why does the belly button look like an outie? I want my baby to have an innie. So that just means that it's protruding or it has pulled in. Babies naturally, when they are born, have split muscles in their tummy because it had to accommodate the blood vessels that ran into the body from the umbilical cord. Gradually, over the next 3 to 6 months, as your baby learns to sit and crawl, they will be doing some core exercises that help to strengthen and heal and close those muscles so that the belly button will pull in. It's almost natural for little ones to have a little bit of a hernia in those first few months after the birth. Please do not apply a bandage or any other foreign object around the baby's belly to try and pull the belly button in. This weakens the abdominal wall and can actually make a hernia worse, as well as restricting the baby's breathing, which can be a danger to their well-being. So when you are caring for the baby's navel, just use only the salt water or the Wexin powder. Don't use any foreign substances or ointments that are recommended by family or friends. I hope that that helps to clarify how to care for the umbilical cord, because I know that this is something that parents often find really intimidating, especially when it is their first baby. So don't be scared, just clean it on a regular basis. It will heal mostly on its own.